The pancreas is a long, narrow organ composed of exocrine and endocrine glands. The pancreas is located across the back of the abdomen, behind the stomach. The right side of the organ, which is the widest part, is called the head. It sits in the curve of the duodenum, the first section of the small intestine. The more narrow left side extends slightly upward, called the body of the pancreas, and ends near the spleen, called the tail. Pancreas's function. Pancreas is an important part to the digestive system. It makes major enzymes and hormones that help the stomach break down foods. It has an endocrine function because it directly infuses juices into the bloodstream, and it releases juices into the ducts, so it makes the pancreas have an exocrine function. The enzymes and juices produced by the pancreas are moved to the small intestine to break down the food after it leaves the stomach. The pancreas also produces insulin, which helps regulate the body's glucose and sugar level.
Beneath your ribs, you'll find, among other things, the pancreas, an organ that works a lot like a personal health coach. This organ controls your sugar levels and produces a special juice that releases the nutrients from your food to help keep you in the best possible shape. The pancreas sits just behind your stomach, an appropriate home, as one of its jobs is to break down the food you eat. It aids digestion by producing a special tonic made of water, sodium bicarbonate, and digestive enzymes. Sodium bicarbonate neutralizes the stomach's natural acidity, so these digestive enzymes can perform their jobs. Lipase breaks down fatty substances. Protease splits up proteins, and amylase divides carbohydrates to create energy-rich sugars. Most of those nutrients then get absorbed into the bloodstream and go on to enrich the body.
The appendix is a small tubular extension on the right side of the colon. It is located closely to the junction of the small intestines and the large intestines, about 2 centimeters beneath the ileocecal valve. The colon has 3 outer longitudinal muscle bands called the tinea that run the length of the colon. The appendix arises from the pouch of the cecum where the 3 tinea merge. The scientific name of the appendix is vermiform appendix. Vermiform means worm-shaped. Although the appendix ranges from a length of 2 centimeters to 20 centimeters, the average length is 10 centimeters, with the usual diameter between 7 and 8 millimeters. The function of the appendix. There is no known function for the appendix. Although there are theories on what the function could be, some believe that it acts as a storage area for good bacteria after a diarrheal illness. But others believe that the appendix is a useless leftover from our past. A common disorder that the appendix gets is appendicitis. What is appendicitis? Well, it's an infection of the appendix. Some symptoms that people with appendicitis experience are fever, sharp pain in the right lower abdomen that worsen with movement, vomiting, and loss of appetite. Appendicitis is most often caused by a blockage of bacteria in the tissue lining the appendix. The bacteria builds up and the subsequent infection causes the appendix to swell and threaten to rupture, which would release the buildup of bacteria into the body. Since the symptoms of appendicitis are very similar to many other abdominal disorders, diagnosis of appendicitis can be confirmed by testing the blood for a high white blood cell count, which is indicative of the infection. And urine can be tested to rule out a kidney stone or urinary tract infection. The prognosis for treated appendicitis, regardless of rupture, is very good. However, if the appendix ruptures or bursts, the prognosis of survival falls from 94% to 90%, as rupture can cause the peritoneum, a thin membrane lining the abdominal wall, to become infected as well, leading to peritonitis. A burst appendix can also cause a pus-filled abscess to form. The most common treatment for appendicitis is an appendectomy, surgical removal of the appendix. If the appendix has burst, the surgeon may need to perform an open appendectomy to surgically clean out the cavity. Otherwise, a minimally invasive laparoscopic surgery can be used to remove the appendix.